use the auricle to actually sort of
like move it around?
Yeah, and then it might open up the canal a little bit better for you.
Today we're in the Clinical Skill Center, and what we do is we practice talking to patients who have been trained to teach us what good techniques are and what maybe not so good techniques are. It looked healthy, no bulging or perforations.
You want to try the other ear?
Okay. So it simulates the kind of environment that you'll get when you actually get to your rotations in the hospital.
What's unique about our school is that we start very early on teaching students communication skills and physical exam skills right in their very first semester.
In this safe environment, we're able to develop our empathy skills and our compassion skills, and especially our communication skills.
Everybody's seen from taking patient histories that I realized some things that I need to work on it.
We try to create as realistic an experience for learners as possible. Regular exam rooms, procedure rooms, assembly areas, meeting areas. We have point-of-care computer terminals identical to what's used in the hospital. They log into that, they go into the room, conduct the encounter just like the real thing.
As a first-year medical student, going through those motions and learning how to take appropriate notes and learn what is important to document and what is not as important is an opportunity that the technology here affords us.
At this Clinical Skills Center, we have the ability to test the students on a variety of skills, not only their skills with physical exam, but communication, specialized communication, for example, breaking bad news, discussing treatment plans with patients, counseling.
Other than the diabetes and high cholesterol, are there any other medical conditions?
Not for me, no.
It's really neat because you get to work with standardized patients who act like real patients, and they kind of help you warm up to the idea of speaking to a real patient in our 3rd and 4th years and afterwards in residency.
I try to focus on what did I learn in class this week. So if we're looking at the heart, what different sounds am I listening to and what do those mean and how do those correlate to the diseases that we're learning about in our classes.
The success of students depends on their being able to practice and demonstrate not just the individual skills, but how all of these individual skills culminate in the most polished and poised and professional physician they can be.
Students who have gone through this program have come back to tell us how well prepared they feel to function in a high-pressure setting of the hospital.
I honestly really enjoy getting feedback because it helps me understand how to improve, and that's exactly why I'm here, is to learn to get better.
The skills that I am learning here at OUWB in my first year directly correlate with the rest of my life in a career of medicine. As a physician, I'll be using all of these clinical skills to diagnose patients and pathologies that ultimately will make me a better physician.